In the interest of community service, Power 88 presents live talk shows to inform, enlighten, and to stimulate thought and dialogue. The views expressed on this program are not necessarily those of the staff and management of KCEP or the EOB. Now sit back, relax, and enjoy the program, or call in and participate at 647-3688. Funding for community partners for better health on KCEP Power 88 is underwritten by the Southern Nevada Health District. And here is your host.
Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm Will Rucker. Uh-oh, Ciara's on the line. Can we get her mic open? Let's try that one more time. I'm Will Rucker.
And I'm Ciara.
There we go. All right. And we are so excited that you have joined us for today's program. Today we are focusing on heart health. It's February. There are a couple big things that happened. We just had the Super Bowl and lots of love on that amazing halftime show.
Yes, shout out to Bad Bunny.
Yes. And we've got Valentine's Lover's Day coming up.
Yes, it's on Saturday.
Yes. You know, so I was doing a little research. This is not new research. It's old research, but I was re-researching. And I found out a 20-second hug can extend your life.
Oh, a 20-second hug?
A 20-second. So hugging somebody that you love for 20 seconds. Now, if you do 18, that's probably all right, too. But 20 seconds is about how long it takes for your body to really shift, because what happens is you release oxytocin, and so that helps you just to really feel better, reduces your stress, lowers the blood pressure, and really helps you to feel bonded and safe like you're not alone.
I love that. So is that a 20-second hug every day, once a week? How often? Because I haven't been hugged today.
Well, I'm going to give you a hug long distance. How about that?
Yes.
But yeah, I think it works just about as often as you want to try it. And you know, us in this society, we do some side hugs and just, hey, how you doing?
Yep.
No, we need to start like hugging folks for real. Heart to heart.
As soon as I finish the call today, I'm going to go hug somebody for 20 seconds. Someone that I love.
That's
someone
right.
I care for. I'll definitely keep leaning to that. Thank you, Will.
And Ciara, I know you booed up, so an 8-second kiss will do it too.
You know I'm no longer booed up.
What?
I'm out here. Single out here. First time in almost 3 years.
Okay, call me after the show because we got to talk. This is A Healthier Tomorrow, and we are sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. February is Heart Month. Heart disease is the number one killer of all Americans, but the risk is higher for African Americans. We're partnering with the YMCA to offer a free blood pressure self-monitoring program starting this month. To see if you qualify, call Courtney at 702-522-7370. I'll give you that number one more time. That's Courtney at 702-522-7370 to find free blood pressure screening locations and other resources. You can also visit our website at www.gethealthyclarkcounty.org. Well, Ciara, we have 3 amazing guests today. I'm going to start with none other than Angel Garcia from Dignity Health. Angel, welcome to the program.
Hi, Will. Thank you for having me here.
Yeah, so glad that you could be here. It is your first time. Hopefully it won't be the last.
Definitely not.
Yes, but you are here to help us talk about Heart Month and heart disease. So kick us off. What's the thing that folks should know?
So what's interesting about heart disease is the number one killer in the States, unfortunately. Even about 1 in every 5 deaths in the United States is related to heart disease. And one of the worst things is that one person every 34 seconds dies of heart disease.
Wow.
And it's more common to see it in our communities, African Americans, Hispanics, that we see the prevalence rate of cardiovascular disease. And this is related to the risk factors of smoking, physical inactivity, unhealthy diets, and also if people have diabetes, have a high risk of developing cardiovascular disease.
Wow.
When we think about this, Angel, thank you so much. This is our aunties, our uncles, ourselves. So when we hear about high blood pressure and cholesterol in particular, can you break down why those matter in like the simplest of forms?
Yes, imagine that when we have high blood pressure, it could also be related to high cholesterol. As when we have high levels of cholesterol, our veins or our arteries start clogging, specifically with plaque, and that obstructs the blood flow, making our high blood pressure increase. Even people that have higher sodium diets, unfortunately, also increases the risk of having hypertension.
Can you talk a moment about the sodium? What is the amount of sodium folks should actually be having?
So ideally, based on what the American Heart Association recommends, we should be having less than 2,300 milligrams of sodium a day, which is about the same as 1 teaspoon of salt.
Wow.
Oh, wow. That makes me think about the cooking and the young kids with the cup of noodles and everything else. That sodium is knocking out the park early. When we think about this, like, what is about our Healthy Heart program that helps people really learn how to protect their heart? We know our challenges. We know the issues that we're going through. How can we combat that and be a little proactive?
So the good thing about the Healthy Heart program that we offer at Dignity Health is that it's a 4-week session that participants meet once a week for about 1 hour with either a registered dietitian or a registered nurse or an experienced health educator to talk about different topics on managing cholesterol, specifically understanding what is the good and the bad cholesterol, understanding the numbers so that they can also have better communication with their providers, so that they know how to take action, especially when it comes to their diet, and if it comes to having medications, understand also what types of medications will work better for them. But also talking about physical activity and how improve physical activity, since it's not just talking about exercising, but being more physically active, doing more things at home, parking farther from the store, just being more active, moving more, as opposed to not just thinking of going to the gym or running or things like physical activity.
And I know with physical activity, the other side of that coin is relaxation and stress. Can you talk about that?
Yes, of course. Stress can also increase hypertension or the risk of hypertension. So it is good to think about methods that can help us relax for a moment, because unfortunately, we are all going to have some level of stress. But it just depends on how we decide to manage that stress. And it's finding activities that will work better for us to work with our mental health, so that we can reduce stress either by doing an activity like physical activity again, or reading a book, listening to music, talking to friends, going for a walk, even just go window shopping. That could also count as physical activity, and it could also be as your de-stressor. And like you were saying earlier, 20 minutes of a hug, that could also be one way to help us reduce that stress level, stress management. So we need to be hugging more.
Yes. And shopping more, apparently.
Apparently, yes. Well, window shopping.
I love the window shopping part, Angel, the window shopping. and the stress is so real. I went to the doctor last month and they said my blood pressure, and it was so low, and I just thought about things that I removed from my plate, and that's the only thing that I changed. And I'm like, let me get my diet in order and it'll be even lower. So, Angel, you're real. Ultimately, it sounds like the goal of our Healthy Heart program truly is giving us those tools that we can use every single day that makes tackling or being proactive about our health seem so accessible.
Definitely. The main idea with the Healthy Heart program is to give everyone the skills and tools they need to live an active and healthier life, focusing more in understanding what will be a healthy choice, how to make healthy choices, I should say better, how to differentiate what types of fats will be better for our body and what types of fats we need to avoid so that we can reduce our cholesterol levels, understanding what fiber is and how fiber can help us also improve our cholesterol levels, understanding how physical activity again helps us, but especially not just about the healthy eating part of making healthy choices, but also how to prepare the foods. That will be also a way to enjoy and not having a strict diet where we just have to be thinking of eating foods that are going to be extremely limited of anything in particular, but to actually have the freedom of choosing what we like, but practicing moderation.
That's so good, and it's the moderation is the key there.
Exactly.
It's not saying you can't ever have anything that tastes good, right? It's really learning how to make things taste the way you like it with a different tool, not always just the salt. Sometimes it's maybe a little herb or a little lemon juice or something. Mm-hmm. But also you can have things that you really, really like, just not all the time.
Exactly. And that's the key again, moderation.
Yeah, that's so important. So I hear about complimentary heart kits. Can you talk about those?
Yes, of course. So again, the focus with the Healthy Heart program is to help people have the tools so that they can improve their diet as well. And the heart kits are specifically produce deliveries that we do for those that complete the program, the Healthy Heart program.
Nice.
So those that complete the 4-week sessions, they're able to choose to be enrolled in the 3 months food delivery program that we have. So they will receive a produce box with about different types of vegetables and fruits, about 5 different types of vegetables and fruits every 2 weeks. And they will be delivered at their door.
Wow. So if they go through the 4-week program, then for 3 months, they will then get produce delivered to their front door.
Yes. And again, the idea is to motivate them to include more fruits and vegetables to their diet.
That's fantastic.
All right, so Angel, this sounds absolutely fantastic. It's something that I would want to participate in as well as my loved ones. How can listeners find out more or join this amazing, amazing program?
So we actually have one workshop that is going to start soon in March at our North Las Vegas location, exactly at the corner of Craig and Martin Luther King at our Dignity Health Wellness Center.
Okay, that's over by, is that Craig Park?
Craig,
okay.
Yes.
Yeah.
Craig and Martin Luther King, right at the corner.
Perfect.
So it will start on March 6th. It's on a Friday, and it will be around from 1 to 3 p.m. The time might change, but if you want to enroll or you want to have more information, you can always call us at 702-616-4932.
Give us that number one more time.
702-616-4932. You're free to call, or you could also send a text message to that number.
Okay, good. Well, we want to encourage you, if you're listening, to enroll if you have the time. If you don't have the time, make the time, because this is important. Your heart keeps you going. So, Angel, thank you for being with us today. Before I let you go, I'm just really curious about how you got into the work, because people don't do this type of work without some sort of story behind it.
All right. Yes, of course. When I was back in college, one of my majors was actually to be a graphic designer. But then back then I used to be overweight. I weighed about 240 pounds. So I started making some healthy changes. And with those changes, I decided to actually go into public health. And in the beginning, I started working with families, actually, children that were going through childhood obesity. And once I decided to transition here to Vegas, because I come from California, I started working with Dignity Health, and it was specifically with chronic disease. And I've always been interested in helping people choose a healthier lifestyle, because I know it's possible.
I love that. And so really what I'm hearing you talk about is prevention, helping folks before they need the intervention.
Yes, definitely. And I'm a strong believer that education is the best method of prevention. Once we learn what we need to do, especially when it comes to our health, we're able to prevent any condition from getting either worse or from actually getting it. And heart disease is one that can be managed. Same thing as diabetes.
Such an important message. Thank you, Angel.
Thank you.
The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Join us for the 3rd annual Because We Matter Tobacco-Free Living Summit on Friday, February 19th from 9:30 a.m. to 2:30 p.m. at the Pearson Community Center. This is a free event and lunch is included. There's still time to register, y'all. For more information and to sign up, visit www.becausewematter.lv.org.
Awesome. Well, we've got yet another powerhouse duo in the house. I think one of them might be being a little shy today, although I don't know why. But joining us from the Southern Nevada Health District, our girl, our auntie, our sister, Amineh Harvey. Welcome to the show.
Good morning.
And this is a very familiar face. We do stuff together all the time, so I don't know why it's the first time on the show, but we've got Daidre as well from the Health District. Welcome.
Thank you so much. I'm happy to be here.
Glad that you are here. So we are looking at a few different things going on, but before we talk a little bit about heart disease and stroke, Amineh, you just had a fantastic event.
Yes.
Can you share just a little bit about it?
Absolutely. On this past Friday was National Go Red for women in support of heart disease, and we held our annual Salon Talk event. It was an incredible event. We hosted over at Expertise Cosmetology Institute. We had a phenomenal panelist of experts that shared information about heart health, brain health, nutrition, self-management. So if you were not in the room, you missed a treat. And this is an annual event that we have curated for Black women, but any woman is welcome in this space to have the information so that they can make healthier choices. And we just want to make sure that women can live healthy, live heart healthy. What's good for your heart is good for the brain. And that was the focus for this event.
Oh, that is powerful. What's good for the heart is good for the brain, too. I got
to spill that, Amineh, for sure.
Well, I didn't make it up, so I want to, put that out there. I definitely got that from one of my partners over at the Alzheimer's Association, so I don't want to coin anybody's phrase.
They said it first, but you said it best.
Yes. When we look at this, and you mentioned not just women, Black women, but everyone, but nearly half African American adults have some form of cardiovascular disease. Why are we disproportionately impacted?
The reason that African Americans are most impacted, there's a lot of reasons, right? It's systemic racism, discrimination. There's not always healthy options around the neighborhoods, right? There's a lot of reasons. There's some mistrust sometimes also in the community, right? With reason.
Yes.
So there is a lot of reasons, and that's the reason why we're here to kind of talk about those things and kind of, provide that trust within the community in order to continue living a heart healthy life.
Yeah, and you said a big word there, trust.
Mm-hmm.
It is so important that we build that, and that's one of the things I love about this program is we get to have the community hear from experts and folks that are out here doing the work and build that trust,
right,
and build that familiarity, because that's where it comes from. You get to know each other.
Yeah, we've seen that, and I'd even like to add that we're more self-sensitive too, and we have an earlier onset of hypertension. Sometimes it's we're not accessing the doctors at the same rate as our counterparts, and that's similar to what Daidre had mentioned. And one of our goals is that we do screening events in the barbershops and the salons, and our hope is to connect people to the appropriate health care so that they can go in and have early intervention, and so they're not at that tertiary stage where now they're having symptoms and then they're at the hospital. We're trying to help them on that preventive level. Just kind of raising awareness really is essentially what we're doing, and we hope that we can combat that burden of heart disease and hypertension that we know is one of the causes of heart disease.
Yeah. And Daidre, I've got a question around blood pressure specifically. So we know what normal is, but there are also additional categories, because you may not have high, but you may have elevated. Can you talk a little bit about the differences?
Yeah, of course. So just to kind of talk about what blood pressure, we hear about it all the time. What is it really, right? So blood pressure is measuring the pressure of blood against the walls of your artery, right? And it's measured in two numbers. You have your top number, which is your systolic number, and you have your bottom number, which is your diastolic number. So what the top number is measuring is the pressure when your heart is beating, that pressure against your walls of your artery. Your bottom number is measuring when your heart is at rest or when your heart is not beating. So that's kind of how the numbers are measured. So as we know, normal is less than 120/80, and then you have elevated, which is 120 to 129 over less than 80. And there are two stages of high blood pressure. You have stage 1 and you have stage 2. So stage 1 is between 130 to 139 over 80 over 89 or 89. And then you have your stage 2, which is greater than 140 or greater than 90. I do want to emphasize hypertensive crisis. So what that is when your numbers are, your top number is 180 and your bottom number is 120. And I want to emphasize that if your numbers are ever that high, you need to seek medical attention, because those are numbers that are stroke level or heart attack level.
Wow. Yeah, that's important to know. So I'm going to skip ahead a little bit, but I know you're having a blood pressure screening event. If we can't get to that event, how can people check on their blood pressure?
So we try to do our monthly screenings, and those can be found on our community calendar. We also have some of our shops that have what we call self-administered blood pressure monitoring stations. So you don't have to be a client there or a customer to use these monitoring systems that we have. We have about 4 of them. We have them at Executive Cuts, Hats Off Barbershop, 5-Star Barbershop, Expertise Cosmetology Institute. And if these locations may be a little far, we can also go to CVS, Albertsons, and I recently found out there's some gyms that actually do offer those similar monitoring systems as well. And we do have a screening event this Sunday at Mountaintop Faith Ministries, and it's going to be during their 10 a.m. service. But just to emphasize, if anyone is interested, they can visit our community calendar, which can be found on our website, which is www.gethealthyclarkcounty.org. When you get on the website, there's a little icon on the left-hand side that has a calendar. If you click on it, you will be able to see all of our screening events.
Fantastic.
So when it comes down to it, Angel already told us about the recommended amount of sodium that we should have, because we know that really impacts blood pressure and different things of that nature related to our healthy heart health. But what people are not realizing is oftentimes it's not coming from the salt shaker. It's not us adding extra things to our food, but more so from processed and restaurant food. So how can someone realistically cut back on their sodium when they may not even realize that they're actually taking in as much as they are?
So, yeah, like you mentioned, a lot of the food that we consume is from processed foods, right? So the best way to kind of look at that is reading the food labels. Your food labels, especially in frozen and packaged food, has a lot of sodium. So it's really important to kind of notate that, right? When you're trying to limit what you eat at restaurants or fast food chains, because they do consume there is a lot of sodium added. And so sometimes it's best to just make your own food at home and be able to control what you're adding to it, and kind of steering away from seasonings that have sodium. So kind of have Angel had mentioned earlier, using herbs and spices that don't have sodium. There are some spices like Mrs. Dash that can be used for food, and lemon, like was mentioned earlier. So those are some ways that we could kind of reduce adding more sodium. And it's really important, especially if you do have high blood pressure, to monitor how much you're consuming, because as it was mentioned earlier, 1,500 milligrams is what's recommended for someone who has high blood pressure. So that's how much sodium they should be consuming. So it's really important to also kind of monitor that as well.
So this is not on your talking point, so if you don't have an answer, just tell me that. It's all right. But what about low blood pressure?
That's a great question that I really don't know the answer to that. I've been asked when I'm out in the field, like, they have low blood pressure and what's that considered. Based on the research I've seen, it's just when your blood pressure hits lower than 90. But that's a great question. I don't really know.
Okay, we're going to have a guest on about low blood pressure one of these days. Amineh, go ahead.
If you do have low blood pressure can give some of the same symptoms, feeling lightheaded, feeling dizziness. And if you're having low blood pressure, we always recommend people to follow up with their healthcare provider, and their healthcare provider can give them some guidance on, where your blood pressure should be. If it were to reach a certain level, then, that's when maybe you need to seek medical attention if their blood pressure is significantly lower than the recommended guidelines of less than 120/80.
Got it. Yeah, that's interesting because, the point I really want to drive home is we need to be monitoring and knowing our numbers.
Absolutely.
So
yes.
Whether it's high or low or normal, we should know.
Yes. Don't assume. Know your numbers. And it's not just knowing your blood pressure, but we always, one of the messaging that we give out in the barbershops or in the salons or just in the community in general is know your numbers. That includes your blood pressure, your cholesterol, and your glucose, because those are 3 comorbidities. And so it's really important that you know what those numbers are.
All right, so y'all tell us about this heart health giveaway that's happening this month.
Oh, we got one more comment. Go ahead, Angel.
One of the ideas that we've always had about the numbers is to know your ABCs.
Yes.
So your A will be your A1C, which is related to your glucose levels for diabetes. Your B for your blood pressure, and your C for cholesterol, to know your cholesterol.
Yes.
So we want to know our ABCs.
Right. That's a good way to put it, an easy way for people to remember. Thank you, Angel, for that.
That is fantastic. Yes.
I like that.
Mm-hmm.
All right. Heart health giveaway.
Okay, so let's talk about that, right? So in honor of Heart Month, we are doing a heart health giveaway. So it does end tomorrow, but there's still time to enter. So the way that you enter is by following our Get Healthy Clark County on Instagram. There is a question on there, and you'll respond in the comments. And by Friday, the winner will be announced.
Awesome. And what does the winner get?
A $50 gift card.
All right. Am I able to enter?
No, sorry.
Okay. Awesome. Well, I so appreciate you both coming on, and Angel for the earlier segment as well. This is an important topic. We've got to take care of our hearts, and as Amineh put it, the heart health is connected to the brain health. Say your tagline, because I'm gonna mess it up.
A healthy brain is what's good for the brain. What's good for the heart is good for the brain. So you almost made me get it all mixed up.
Awesome. Thank you so much. So, Ciara, what's going on in the community?
Yo, let me tell you, as you mentioned, on Saturday, it is Valentine's Day, but let's say you do not have a Valentine. The center is doing a Galentine's Day brunch, which will be absolutely amazing. It is a way for you to get together, have some great food, share some love with the community. You can RSVP at the center's website. This event is going to happen on Saturday, and it is going to go from 11 to 1 p.m. Then we have some Healthy Heart Expos happening outside in the community, y'all. So you can dive in for the 26th annual Health and Wellness Expo that's going to be happening on April 18th. So plan ahead at 10 a.m. at the Las Vegas Santa Fe Station Hotel and Casino, as well as an amazing series that is being held for, we're talking about Women's Health Matters. So real talk for real women, and really dive in and learn more about healthcare advocacy. The next event is actually this evening, February 11th, and it is going to be also next month on March 11th. So dive in. It'll be at Loaded Empanadas, and it is a free event that is always held at 12 p.m.
Awesome. Well, lots of stuff, as always, going on in our fantastic community. Vegas is such a special place. It's amazing to live here. So y'all get out, do something good for yourself, hug somebody, love on somebody. This has been A Healthier Tomorrow. I'm Will Rucker.
And I'm Ciara Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately and stay healthy, y'all.
Yes. Have a Wellness Wednesday, y'all.
We'll see you next time.